York's #1 news. Channel 7 Eyewitness News.
Well, worries about the flu sweeping the country tonight. Doctors are now calling this the worst outbreak in more than a decade. In fact, 41 states have reported cases of the virus, and in some cities, emergency rooms are overflowing. So how are local hospitals preparing, and how can you still stay healthy? Here's Eyewitness News reporter Jim Dolan.
Lawrence Johansson is a mess.
I feel terrible. Got a headache, fever, throwing up. Just about everything you can imagine. All my joints hurt, my bones.
It's bad.
Yeah, it's real bad.
Johansson is one of the many patients who have come to St. Barnabas Hospital in the Bronx feeling like they'd just been run over by a truck. That's what the flu is like this year.
Flu season was pretty non-existent. We had some flu. This year, it seems like a lot more people, a lot more people are coming in and being diagnosed with the flu. So we're getting a lot more cases.
And it's not just here. In Allentown, Pennsylvania, they've had so many cases they had to set up a tent outside the emergency room to deal with them all. And in Chicago, some hospital emergency rooms had to go on bypass, meaning they couldn't accept any more patients because of the overflow from the flu. So why is it so much worse this year? Well, some think it might have something to do with the timing. You see, flu season came early this year. In fact, it came just in time for the holidays.
I think that because people are so social in the time period between Thanksgiving and New Year's and can't avoid being in contact with one another at holiday parties, family events, air travel, the flu has really spread quickly.
Doctors say get a flu shot. It's not too late. In the Bronx, Jim Dolan, Channel 7 Eyewitness News.
From NBC News World Headquarters in New York, this is NBC Nightly News with Brian Williams.
Good evening. When we talk about flu season this year getting off to a galloping and virulent start, this is what we mean. Live picture of Lehigh Valley Hospital in Pennsylvania, where they've got a tent set up out back to treat the overflow patients. In areas where the flu is bad, it's very bad. And for healthcare professionals, it means more patients showing up at hospitals than they can treat in some cases. And remember, that's among those so sick with the flu they require hospitalization. The flu is now widespread in 41 of our 50 states. It is all where we begin tonight with our chief medical editor, Dr. Nancy Snyderman. Nancy, good evening.
Good evening, Brian. This is the worst flu season we've seen in more than a decade. It has the CDC concerned. And tonight, cities across the country and their hospitals are feeling the strain. And we haven't even reached the 50-yard line of flu season.
Emergency departments have become ground zero in the fight against the flu. At New York St. Barnabas Hospital, the hallways are packed with patients.
What's the status today?
Well, right now, compared to last year at this time, we've seen 3 times as many flu patients as we've seen all of last year.
More than 50 cases a day of flu-like symptoms.
Is it fair to say that you are overflow?
I'd say yes, we're at overflow right now. Yes, we definitely are. We're very busy. We're very busy.
Patients like Lawrence Johansson.
Yesterday morning, I started getting dizzy, fever, just feeling terrible.
You look like you feel lousy.
They do.
At Boston's Brigham and Women's Hospital, they've seen more flu already this year than they did all of last year. Veteran ER Dr. Charles Posner.
Patients usually come in feeling like they've been run over by a bus. They basically have body aches, joint aches, they feel feverish, they oftentimes have sweats.
In Chicago, hospitals are so overwhelmed with patients, 7 have closed their emergency departments, diverting ambulances to other facilities. At a hospital in Allentown, Pennsylvania, they're dealing with the onslaught of patients by triaging them in a tent in the parking lot. This influenza virus is tenacious. Droplets from a sneeze or a cough can be anywhere, on a doorknob, a keyboard, even a pen for up to 8 hours. So how can you avoid the flu? There are some simple precautions. Wash your hands frequently, 15 to 30 seconds at a time. Keep your hands away from your eyes and nose. You touch your face more than 2,000 times a day, and that's the easiest place for the virus to latch on.
So far, I don't think it's peaked yet. You know, it's still rising.
If you think you're at risk, the answer might just be a click away. On flunearyou.org, 20,000 volunteers are compiling reports so you can check how severe the outbreak is in your zip code. There's a Facebook app that checks your friend's status for words like cough or sneeze. And the CDC has an app which tracks case data state by state.
If you think you have the flu, call your primary care doctor immediately, because there are medications you can take that can minimize the symptoms and the length of the illness. Don't go immediately to the emergency room. The hallmark remains prevention, and that means for almost everyone out there, that's a flu shot. We undervalue prevention in this country, Brian. I think we have to drive home the fact that this is a virus that can put you in the ICU within 48 hours. This is not a season to fiddle around with.
And the flu shot is a good one this year.
It's good, it's a perfect match, and it's available.
All right, Dr. Nancy Snyderman starting us off tonight.
As local news gets. News 12, the Bronx.
An outbreak of the flu has area hospitals working overtime. The state health department says emergency rooms are seeing double the patients because of the virus. That's where we find News 12's Alicia Laventure with this 12 on Health Report.
It's been really crazy lately.
Crazy in the emergency room at St. Barnabas Hospital. Dr. Ernest Patti is the senior attending physician there and says 20% of the influx is because of the flu.
If we're looking at a slope, we haven't even peaked yet. We're still going up the slope. So buckle your seatbelts.
The latest numbers from the state health department show the number of patients that tested positive for influenza last week jumped 55% from the week before. Iris Estrella came in Wednesday morning with symptoms.
I have a cough, fever. I have a lot of pain in my legs.
Emergency room physicians at St. Barnes are on high alert. Anyone who comes into the ER with any symptoms of the flu automatically gets one of these masks. It's to make sure any germs that they have don't spread to other patients in the hospital.
I don't like it.
You don't like it?
Because I have to keep taking it off to blow my nose and putting it back on.
Luz Colon is missing a week of school because she's got the flu.
Pretty much to take, like, liquids and medicine.
St. Barnes has a protocol where doctors will section off flu patients if the ER reaches maximum capacity. Extra staff is on standby and is being encouraged to get vaccinated to handle the outbreak.
It's never too late to get a flu shot. Get your flu shot.
From St. Barnabas Hospital, Alicia Laventure, News 12, The Bronx.
And if you want to know the nearest location where you can get a flu shot, visit our website at news12.com and click on numbers and links.
I want to get to some other news at this hour, and this is a Fox News alert on this flu outbreak as the death toll climbs and one federal health agency starts calling this an epidemic. Welcome back, everybody. I'm Megan Kelly. With flu infections way up this season, hospitals are struggling to deal with overflowing emergency rooms. One hospital in Pennsylvania even forced to set up a special tent to deal with the influx of sick patients. We showed it to you earlier. Dr. Ernest Patti is the senior attending physician of emergency medicine at St. Barnabas Hospital here in New York City. Dr. Patti, thanks for being here.
Thanks for having me, Megan.
How bad is it?
It's very bad. I mean, our volume normally on a busy day in the hospital is about 250 patients. We're seeing well over 300 patients a day, and a large percentage of that, about 20%, is probably due to flu and flu-like illness.
Is it babies? Is it children? Is it elderly?
It's pretty much spanning the whole gamut. I mean, just the other day we had a 26-day-old child who tested positive for flu. Fortunately, that baby's doing quite well. We've also had some elderly patients with the flu, and the spectrum runs through the middle as well with the middle-aged teenagers.
On the subject of a newborn baby, could you even give a newborn baby the flu vaccination?
No, we wouldn't give them the vaccination, but what we're doing is treating the baby with antiviral medications. There are CDC guidelines now that we've referred to that allow us to use it in treating children that are very young as well.
I heard earlier that children who are younger than 5 are the most at risk. Is that true?
Definitely. The very young and the very old, that's how we remember it, and those with other health diseases, asthma, people with diabetes, people who have emphysema, those who maybe are on chemotherapy, you know, for cancers or immunosuppressed for other reasons.
You see the map and you see 47 states describing it as a widespread flu outbreak, and it looks a little scary. I mean, it's just, you know, you think of the movie Outbreak and you think, how far is it spreading? How fast is it spreading? How far is it going to go? And why is it so bad?
Well, it's very concerning. What I think is probably the reason it's been so bad lately is it started right before the holidays. Don't forget, people travel all over the country. They gather in large gatherings, get together, and spend time together, share meals. It's easy to spread the flu, very easy. But the good news is there's very easy ways in which to protect yourself and stay healthy. Remember, you have to wash your hands. You know, I was going to bring the
hot water, and you're supposed to sing Happy Birthday while you do it.
Yes, you're supposed to sing Happy Birthday, 15 to 30 seconds. So I brought some antibacterial scrub, which you can use in lieu of soap and water, but soap and water is really the best. Cover your cold. you know, with either your elbow or your hands. Wash your hands frequently, use tissues and throw them away. If you're around people that are sick, there's nothing wrong with wearing masks. We use these at the hospital when patients show up who have flu-like symptoms before we diagnose them with the flu. And get your flu vaccine.
Yeah, right.
So it's very, very important. You have to be careful. You travel public transportation, you're touching doorknobs and handrails. Really wash your hands frequently.
How long can the flu virus live? You know, the subway railing, or even if, let's say you cough into your elbow. I mean, it's on your sweater, right? So how long can it live there?
8-10 hours. And
really?
I think even some strains could last even longer, yes. So, you know, that's
you can't touch anything.
You have to be careful. And the frequent hand washing is important, you know.
And how about, so let's say you touch that with your glove. Is it then on your glove?
It's then on your gloves, so, you know, you can wipe your gloves down with antibacterial wipes or throw them in the washer if they're, you know, wool.
So
or
nothing
cotton.
kills it other than antibacterial solution and hot water and soap?
Well, hot water soap gets it off your hands. Bleach and disinfectants like that have alcohol in them will also help get rid of it.
And how are people dying? Because, you know, flu, you kind of equate it with, all right, it's like a terrible, terrible cold plus a few symptoms. How are they dying?
People with normal immune systems usually do well with the flu. It passes after a number of days. They treat themselves symptomatically. The problem is there's complications to influenza, and those are the people who maybe let it last, maybe let it go a little too long, maybe they were weak or overworked or overstressed.
But the things that they get,
pneumonia.
they said, you had pneumonia, but isn't that treatable? I mean, don't we have, you know, does penicillin treat pneumonia? Aren't there drugs that treat that?
Well, if you have a bacterial pneumonia, we will have drugs that treat that. But remember, we're dealing with viruses that mutate very quickly, and sometimes they can sneak up on you and, you know, overwhelm your immune system before you actually get to the hospital. People are coming in later in the course of the disease, and it's harder to play catch-up medicine and get back, you know, and treat them effectively sometimes when they have a full-blown pneumonia, say.
Well,
but we do have antibiotics, yes, we do use them when it's indicated.
And doctors have been telling us it's not too late. Get the flu vaccine. You can do it now. It should do it now, and especially now in New York where we're saying it's at dangerous levels.
You should definitely get a flu vaccine.
Yeah, I mean, unless you're in Hawaii, California, or Mississippi, I think. Those are the 3 states, weirdly. I mean, I have no explanation for this, that aren't reporting at least the widespread flu outbreak, but, you know, you're not safe anywhere right now.
People are traveling back and forth, you know, and stay healthy, sleep, eat a good nutritious meal, and rest and drink plenty of fluids.
All right, good deal, Doc. Thank you.
Thank you so much.
Appreciate it.